Hello, everyone. Today, our group will be exploring and comparing the healthcare systems of the United States and China. This comparison is crucial because despite both countries aiming to provide quality healthcare for their populations, they approach it in very different ways. Our focus will be on understanding each country's healthcare structure, how each system is funded, the role of government agencies, and importantly, how accessible healthcare is to people in each nation. In this presentation, we'll discuss a few main areas. First, we'll cover the overall structure and organization of healthcare in each country. Then, we'll look at the roles that specific government agencies play in shaping public health policies, managing health crisis, and supporting research and innovation. We'll also review each country's insurance systems, which determine how people pay for care and how accessible that care is. By the end of this presentation, we hope to provide you with a clear picture of how these two healthcare systems operate, as well as their unique strengths and challenges. One key insight to keep in mind is that the US healthcare system is decentralized and largely market-based, while China's system is highly centralized, with the government managing most aspects of care. These structural differences mean that the US system relies more on private sector involvement, while China's system prioritizes national coordination and public health initiatives. So let's begin by taking a closer look at the US healthcare system. The US healthcare system is unique in many ways, especially compared to other high income nations. Its decentralized market based structure means that instead of having a single unified health system, healthcare in the US is made up of a wide variety of private and public providers, insurers, and facilities. There's no single agency overseeing healthcare for everyone. Instead, multiple government agencies and private companies each have specific roles. For instance, the Centers for Disease Control and Prevention, or CDC, handles public health and disease prevention. The National Institutes of Health, or NIH, focuses on medical research. The Indian Health Services, or IHS, provides health care specific to Native American populations. Together, these agencies work to address the country's healthcare needs, but often in specialized or limited areas rather than on a national coordinated level. Another defining feature of the US healthcare system is its mix of insurance options. Americans access healthcare through a variety of models, including public programs like Medicare for older adults and Medicaid for low income individuals, as well as private insurance, which is often employer based. Additionally, some individuals use hybrid models and combine aspects of both public and private insurance. The Affordable Care Act, or ACA, significantly expanded access to health care by providing subsidies for those who otherwise couldn't afford it. However, many gaps remain, particularly for those people who don't qualify for subsidies or employer sponsored plans.
As we take a look at healthcare system comparisons between the United States and China, there are different approaches to prioritizing public health, insurance, and disease prevention. The US has decentralized and has a market based system, meaning as we are a free country, it depends on your jobs, where you work, the money you have. China has a centralized government managed by the system because they are a communist country and controlled by their government. 95% of people have health care in its population through their basic medical insurance. The similarities is there's an emphasis on public health. As we are a centralized nation here in the United States of America, as I have said, a lot has to do with where you work, the money you have, giving you better health care, and not all are covered. Key organizations that we have, China has a CDC public health. It also has a state medical insurance administration insurance regulation and National Health Commission policy oversight. They also, in the United States, is still kind of the same similarities on that, where there is a CDC that regulates public health and state medical insurance administration that oversees what we're doing in this country as far as insurance goes. And we do have a National Health Commission and policy oversight. All this together, I see a lot of similarities with these two different systems. It's just the difference between how many people are covered and the kind of coverage that they have.
Financial issues in healthcare. There is no denying how intertwined finances are with healthcare, from choosing insurance to the bill the insurance provides. Countries around the world face the same issue of cost of care. The United States is no different. High healthcare costs with employer-based and government-funded insurance options. While there are different government-funded programs which can provide certain coverage to demographics of people, this is definitely limited. Factors for this include age, chronic illness, such as kidney issues, and income, to name a few. There are more, but just a few. This system is not a catch-all, as it still creates gaps for those who appear to make enough money, but are left trying to decide what basic needs they want to meet because of the costs they have to allocate to healthcare, whether that be insurance or actual services. The Affordable Care Act expanded access, but affordability remains an issue. This change was seen by expanding programs that were already in existence to more citizens. They used the Medicare, Medicaid infrastructure to do that. However, the same program created issues for those who maybe wouldn't have normally elected to have health insurance, and now they're required to. China is primarily government funded, but faces high out-of-pocket costs for specialized care. The best way to think about this would be like an out-of-network provider for the United States. So they carry a lot higher cost, whereas maybe like at the basic level or the in-network providers carry significantly reduced cost to visit. Rural areas are affected by this healthcare affordability and lack of access, similarly as they would be in the U.S. Technologies impact the quality of care. Technology advances impact care quality and access. So we kind of talked about this a little above. But it is impossible to separate technology and healthcare at this point. They've become intertwined, and as time has gone on and events have happened around the globe, it's only been exacerbated. The United States has a decentralized electronic health records. While this can cause issues, as if you see people from other health systems, such as specialists, they might not be able to see your chart. Potentially costing patients more because they need tests rerun and things of that nature. China has more of a centralized system, which allows providers to have access to more of the patient's information right off the bat because of how the system is set up. With this being said, they have a better ability to deploy health technology, and they use telehealth in rural areas similar to how the U.S. has and will continue to do.
Major quality improvement systems. For the United States, the quality improvement systems used is for Joint Commission, which go in and verify that facilities and healthcare providers are following the proper protocols and ensuring the safety of the patients. The NCQA is basically the same as the Joint Commission, but they are hired by private practices, and usually they are hired through grants or through some sort of financial system. CMS is the Centers for the Medicare and Medicaid system. These systems are the ones who do the audits for Medicare and Medicaid to make sure that providers and healthcare facilities are billing and following the proper protocols and policies. They set the standards for the billing and for policies and protocols that must be followed in the healthcare systems. If these protocols and policies are not being followed as indicated, they can come in and shut down a system, or they can revoke them from seeing patients from time to time. For China, the quality initiatives that are being put into place is a focus on standardization. For that, they're trying to standardize the care in China and standardize the healthcare insurance and policies that are put into place. They also have a Healthy China 2030 goals, which is a set of goals that has been set forth in China that they should meet these goals by the year 2030 in order to see an improvement in health of their citizens.
On behalf of Team China, I'd like to thank you for listening to our presentation. As we can see, the healthcare delivery systems in China and the United States exhibit stark differences shaped by their unique political, economic, and social landscapes. In China, healthcare is largely influenced by the government's central planning, which aims to provide universal coverage through a publicly funded system, though it still faces challenges such as underfunded rural health services and disparities in quality across regions. On the other hand, the United States relies on a predominantly private, market-driven healthcare system where access and quality vary significantly depending on insurance coverage, leading to challenges like high costs, unequal access, and disparities in health outcomes. While China has made significant strides in expanding access to health care in recent years, the US continues to be the leader in medical innovation and technology. Ultimately, both countries are grappling with the issue of cost, efficiency, and equity, but their approaches highlight the complex trade-offs between public and private models of healthcare delivery. As global health changes continue to evolve, both nations will likely need to adapt their systems to ensure broader and more equitable access to quality care.
All right, and to wrap up, if you're interested in any of the references or reading more about anything that you've seen throughout this presentation, the references will be on the next few slides. Here you go.